Chapter 11, the nervous system. The functions of the nervous system. The nervous system plays a major role in homeostasis, which is keeping the other body systems coordinated and regulated to achieve optimal performance. It accomplishes this goal by helping the individuals respond to his or her internal and external environments. The nervous and endocrine systems are responsible for communication and control throughout the body. There are three main neural functions. 1. Collecting information about the external and internal environment, which is sensing. Processing this information and making decisions about action is interpreting. And directing the body to put its play the decisions that are made is called acting. The study of the nerves is neurology, and one who specializes in the study of the nerves is called a neurologist. Your word parts for this lecture would be neuro is nerve. And this is the diagram of the nervous system, also found in your book. Organization of the nervous system. The CNS, or the central nervous system, contains the most essential elements of the nervous system. The brain is protected by the skull, and the spinal cord by the vertebrae. The PNS, or the peripheral nervous system, includes the nerves that travel to the point of sensation and the nerves that carry the sensation back to the brain. These are termed the efferent or motor nerves and the afferent or sensory nerves. And your word parts, encephalo is brain and myelio is spinal cord. The peripheral nervous system organization. The PNS includes the nerves that travel to the point of sensation and the nerves that carry the sensation back to the brain. These are termed the efferent or motor nerves and the afferent or sensory nerves. The somatic nerves collect information from and return instructions to the skin, muscles, and joint. The autonomic nerves are mostly involuntary and collect information from the internal environment in the body. The information is sent to the CNS, where in return, motor impulses are sent to the involuntary muscles in the heart, glands, and organs. Remember that efferent means to carry away, while afferent means to carry toward. In the nervous system, these terms are used to refer to away from and toward the brain. The cells of the nervous system. The primary units of the nervous system are the nerve cells called neurons. Most neurons have dendrites, which are projections from the cell body. They receive neural impulses called action potentials from the stimulus. This electrochemical impulse travels from the cell body down the axon, a slender, elongated projection that carries the impulse towards the next neuron. Nerves are the final branching of the axon and the site of the axon terminals that store the chemical neurotransmitters. Each axon is covered by material called myelin, which is a substance produced by the Schwann cells that coats the axons. The neurotransmitters are released from the axon terminals to travel across the space between the terminal fibers of one neuron and the dendrites of the next cell. This space between the two neurons is called the synapses. And your word parts, neuro is nerve, on is structure, and dendrite would be dendro. Did you know that the myelin sheath that coats the axons gives the neuron a white appearance in the PNS? Gray matter is the appearance of cell bodies without a myelin sheath seen in the CNS. Glia cells are stromal, which means supportive in nature, holding the neurons together and protecting them. The combining form glio means glue and is used because these cells have the function of holding the nervous cell together. Astrocytes connect neurons and blood vessels and form a structure called the blood-brain barrier that prevents or slows the passage of some drugs and disease-causing organisms to the central nervous system. Microglia function is to engulf and ingest infectious organisms. The epidermal cells line the ventricles of the brain and produce cerebrospinal fluid. Oligodendroglia covers the axons of the neurons forming their myelin sheath. Schwann cells are the only glial cells that appear in the peripheral nervous system. These cells form a fatty substance called myelin that insulates the axons in the PNS. The blood-brain barrier is formed by astrocytes that connect neurons and blood vessels to prevent or slow the passage of some drugs and disease-causing organisms to the CNS. And then you have your word parts. Glia equals glue. Astro is star. Micro is tiny. Oglio is scanty. And dendro is dendrite. The abbreviation BBB can stand for either blood-brain barrier or bundle branch block, a cardiac condition. So be very careful with that abbreviation. The central nervous system consists of the brain and the spinal cord. The brain is divided into 4 sections: the cerebrum, the cerebellum, the diencephalon, and the brainstem. Mylio can mean bone marrow or spinal cord. Memorization and context will help you with the methods to determine which one is which. Your word parts: encephalo is brain, cerebro is cerebrum, cerebello is cerebellum, cordo or mylio is spinal cord. The cerebrum, the largest part of the brain, is divided into 2 hemispheres. It is responsible for thinking, reasoning, and memory. The surfaces are covered with gray matter called the cerebral cortex, which is folded into sulci, which are valleys, and gyri are ridges. The corpus callosum is a thick band of nerve fibers that join the 2 hemispheres. There are 5 lobes of the cerebrum that have varying functions. The frontal lobe is speech and voluntary movement on the contralateral side of the body. The temporal lobe is auditory and olfactory functions. Parietal lobe is sensations of touch and taste. And the occipital lobe is vision. The insular lobes are located under the frontal and temporal lobes and are responsible for empathy, internal sensing, awareness, and cognition. You may want to remember this derivation for insula later in the endocrine system when they are introduced to a hormone produced by island cells, the islets of Langerhans. The basal ganglia are located under the cerebrum and are responsible for a number of functions. The corpus striatum acts as a reception area that actuates the globulus pallidum to perform an inhibitory action on motor function areas. The substantia nigra has a function in the release of dopamine. The subthalamic nucleus influences the globulus pallidum after receiving stimulus from either the cerebral cortex or the corpus striatum. The colostrum is a thin layer of gray matter that is considered to be part of the basal ganglia. Damage to the basal ganglia plays a role in several neurological disorders, including Parkinson's and Huntington's disease. And your word parts: cerebro is cerebrum, cortico is cortex, and lobo is lobe. Be careful. Basal ganglia is a misnomer because ganglia only appears in the PNS. Basal nuclei is the more technically corrected name, although basal ganglia is the more commonly used. Collections of cell bodies in the CNS are termed nuclei, where in the PNS they are called ganglia. Diencephalon. Di meaning two helps one remember that the diencephalon is composed of two structures, the thalamus and the hypothalamus. The thalamus is responsible for the relaying of most sensory information, except the sense of smell, and their translation into sensations of pain, temperature, and touch. The epithalamus, located above the thalamus and including the pineal gland, connects the limbic system to the rest of the brain. The medial and lateral geniculate nuclei are sensory relays within the thalamus. Both together are referred to as the metathalamus. The pulvinar are nuclei located in the medial posterior thalamus with functions involving visual attention. The mammillary bodies are small rounded structures named for the similarity to the appearance of a breast. That helps in the recognition of people, places, objects that are stored in memory. The brainstem and the cerebellum. Brainstem connects the cerebral hemisphere to the spinal cord. It is composed of the midbrain, pons, and the medulla oblongata. The midbrain connects the pons and the cerebellum with the cerebral hemispheres. It is the site of reflex centers for eye and head movements in response to visual and auditory stimuli. The superior and inferior cochlea of the midbrain are composed of sensory, visual, and auditory nerve fibers. The cerebral peduncles of the midbrain are the motor nerve fibers that connect the spinal cord and the cerebellum. The pons serve as a bridge between the medulla oblongata and the cerebrum. The pneumotaxic and the apneustic centers are networks of neurons that function to regulate respiration. The anterior parts of the pons is the basis pontis, which has a role in motor function. The locus coeruleus, the blue spot, functions in the physiological response to stress. The superior olivary nucleus is involved in hearing. The medulla oblongata regulates heart rate, blood pressure, and breathing. The cerebellum is located below the occipital lobe of the cerebrum. It coordinates voluntary movement, but is involuntary in function. Some examples could be walking, a voluntary activity, but is coordinated involuntarily. The spinal cord. The spinal cord extends from the medulla oblongata to the first lumbar vertebrae. From there, it extends into a structure called the cauda equina, which is literally a horse's tail. The conus medullaris is the end of the spinal cord, and the cauda equina is a collection of nerve roots that extend from it. A total of 31 pairs of spinal nerves emerge from the spinal cord at the nerve roots. The next slide will show these structures. And your word parts, cordo or chordo or milio is spinal cord. Rizzo or radiculo is nerve root. Now, by looking at this illustration of the spinal cord, you look at the top, which is your neck area, and that's called your cervical vertebrae. And those are your C1 through C7. And in the middle of your body, which is where your lungs and your heart are, is your thoracic cavity. And those are T1 through T12. Then your lower part of your back, also known as the lumbar vertebrae, is L1 through L5. So if anything is talked about, somebody's got a fracture in their T12, L1, you know exactly that is your last thoracic vertebrae and the first of your lumbar vertebrae. Then after the lumbar vertebrae, you go lower down and you go to your sacrum. And the sacrum has S1 through S5. And then you have your coccyx. Meninges. The bony vertebrae surrounding the spinal cord protected along with the coating of the meninges. The meninges are arranged in 3 layers that are separated by spaces. The dura mater is the tough outer covering of the meninges. Dura mater literally meaning hard mother. It is divided into the cranial dura mater and the spinal dura mater. In the cranial dura mater, the phalanx cerebri is the slickle-shaped fold between the hemispheres. The tentorium cerebelli is an extension of the dura mater that separates the cerebellum from the lower part of the occipital lobes. The diaphragm cellae is a small dural fold that covers the sella turcica with a small opening for the infundulum of the pituitary. And then in your word parts, meningeo or meningio is meninges, duro is dura mater, cranio is cranium, and spino equals spine. The space underneath the dura mater is the subdural space. The next layer is an arachnoid membrane. It is a thin, delicate membrane that takes its name from its spidery appearance. A space underneath is called the subarachnoid space, which contains the cerebrospinal fluid. The fluid is continuous with the ventricles of the brain. The final layer is the pia mater, literally the soft mother, which is a thin vascular membrane. And then your word parts is sub equals under. Ventricles of the brain. The cavities of the brain contain cerebrospinal fluid and are divided into 4 main cavities. Each is connected by foraminina, which are openings. The later ventricles are connected by the foramen of the Monro, and the 3rd and 4th ventricles are connected by the aqueduct of Sylvius. The choroid plexus is the membrane within the ventricles of the brain and spinal cord that is lined with epidermal cells that produce the CSF. A cistern is a dilation of the subarachnoid space that contains CSF. The cisterna magna is between the dorsal surface of the medulla oblongata and the cerebellum and is supplied with CSF from the 4th ventricle. And in your word parts, ventriculo is ventricle and magna equals large. Review question. The combining forms for the part of the central nervous system responsible for thinking, reasoning, and memory is A. Cerebello, B. Cerebro, C. Cranio, or D. Diencephalon. And the answer is B. Cerebro. Remember, cerebro is cerebrum. The peripheral nervous system. The peripheral nervous system is divided into 12 pairs of cranial nerves that conduct impulses between the brain and head, neck, thoracic, and abdominal areas, and 31 pairs of spinal nerves that provide the innervation to the rest of the body. Cranial nerves are named by their number and their function or distribution. For example, the vestibular cochlear nerve, also known as the auditory or acoustic nerve, is the 8th of the 12th cranial nerves. Spinal nerves are named by their location, such as cervical, thoracic, lumbar, or sacral, and coccygeal, and by their number. A plexus is a network of nerve fibers from several spinal nerves. The autonomic nervous system consists of nerves that regulate involuntary muscle and function, which is cardiac and smooth muscle. The motor portion of this system is further divided into the sympathetic and parasympathetic nervous systems. Sympathetic nervous system, fight or flight. It helps individuals respond to stressful situations. Heart rate and blood pressure increase, digestion slows, and sweat and adrenal glands increase secretion. Your parasympathetic nervous system, rest and digest. It helps balance the effect of the sympathetic response. Heart and blood pressure decrease, digestion increases, and adrenal and sweat gland activity decreases. The cranial nerves. Your cranial nerves are named by both their number, written in Roman numerals, and by their function or distribution. Cranial nerve 1 is the olfactory nerve. It originates in the olfactory epithelium and carries the information from the olfactory bulb to the brain to allow us the sense of smell. The cranial nerve 2 is the optic nerve. It originates in the retina of the eye and crosses at the optic chiasma. If damaged in front of the chiasma, loss of vision will be on the same side of the body as the lesion. If distal to the chiasma, the vision loss is on the opposite side from the lesion. The third cranial nerve, the oculomotor nerve, has its origins in the proprioceptors of the muscles of the eyeball. This nerve, along with the trochlear and the abducens, fourth nerves, move the eyeball. The oculomotor nerve is associated with the muscles that change the shape of the lens and constrict the pupil. The fifth cranial nerve, called the trigeminal nerve, has three main branches: the ophthalmic, mandibular, and maxillary nerves. Its origins are in the teeth and skin of the face. The ophthalmic branch relays information from the eye, except from the retina, along with the skin of the forehead and nose. The maxillary branch receives information from the teeth of the upper jaw, sinuses, and skin of the midface. The mandibular branch has both sensory and motor functions for the lower jaw. Each of these arises from the gastrarian ganglion, also called the trigeminal ganglion, which is the site of the dormant herpes virus after primary herpes infection. The seventh cranial nerve is the facial nerve. It originates in the taste buds of the anterior part of the tongue, and it is associated with the muscles for facial expression and the submaxillary and sublingual salivary glands. There are several structures that are coded to this particular nerve that should be noted. The chorda tympani is named for the path through the middle ear, although it is involved in the sensation of taste. The greater superficial petronosal nerves that innervates the lacrimal glands. The nerve to the stapes that innervates the muscles of one of the ossicles of the ear. The parotid plexus, that is the location of branching of the facial nerve at one of the salivary glands near the ear. The posterior ocular ear, that provides sensation from an intervention to the external ear and occipital region of the head. The geniculate ganglion is a mix of sensory, motor, and parasympathetic nerves that provide taste sensation and innervate glands in the head and neck. Submandibular ganglion, part of the autonomic nervous system, one of the four parasympathetic ganglia of the head and neck. Cranial nerve 8, the vestibulocochlear nerve, is termed the Kursic nerve in PCS. Its primary functions are balance and hearing. The vestibular ganglion, also called Scarpa's ganglion, connects the vestibular nerve and the semicircular canals of the inner ear. The spiral ganglion is a collective of nerve cells in the cochlea that sends sound to the cochlear nerve. This too is coded to the cranial nerve. The cranial nerve 9, the glossopharyngeal nerve, is used to code the carotid sinus nerve and the tympanic nerve, also called Jacobson's nerve. The carotid sinus nerve supplies the small cavity at the beginning of the carotid artery and detects pressure and pH changes in the carotid body. The tympanic nerve is a mix of nerve fibers that serve the middle ear, the parotid gland, and the carotid plexus. The vagus nerve, cranial nerve 10, has nerve origins in the lungs, stomach, aorta, and larynx. Its parasympathetic fibers are in the heart, stomach, small intestine, larynx, and esophagus. The anterior and posterior vagal trunks are coated here, along with the superior and recurrent, which is inferior, laryngeal nerves, and the pharyngeal and pulmonary plexus that supply the throat and lungs. The final two cranial nerve numbers 11, spinoaxillary, and 12, hypoglossal, originate in the muscles of the shoulder and muscles of the tongue. But be careful. Don't confuse the optic nerve, the second cranial nerve, with the ophthalmic nerve, which is coded to the trigeminal nerve and fifth cranial nerve. The spinal nerves. Remember that a plexus is a network of nerve fibers from several spinal nerves. Some examples are the cervical and brachial plexuses that supply the neck and arms. Ganglia are the collection of cell bodies in the PNS. Spinal nerves are named by their location, such as cervical, thoracic, lumbar, sacral, or coccygeal, and their number similar to the bones of the spine. A dermatome is the skin surface area supplied by a single afferent, which is a sensory spinal nerve. Patients with shingles show similar patterns as a specific peripheral nerve is affected with this disorder. Myotomes are the areas of muscles that are supplied by a single efferent motor spinal nerve. Be careful. A dermatome is the skin surface area supplied by a single afferent spinal nerve. The term dermatome can also be used to describe an instrument that cuts thin slices of skin for grafting and signifies a mesodermal layer in early development, which becomes the dermal layers of the skin. Myotomes. Now, here is an interesting diagram of the myotomes that divide the body into front and back with the corresponding motor nerves that connect the different areas of the body. Nerves. The occipital nerves are coded to the cervical nerves that supply the muscles of the head and neck. The head and neck sympathetic nerves are used to code several recognizable nerves: the ciliary, optic, cephalopalatine, and submandibular ganglia. The internal carotid plexus and the cavernous plexus are located near the carotid artery in the neck. The internal carotid plexus is lateral to it, while the cavernous plexus is medial and inferior to it. The stellate ganglion is located in the lower part of the neck and is sometimes cut in order to correct excessive sweating or Raynaud's phenomenon. The cervical ganglia are sympathetic nerves in the neck area. The median nerve is where one would code procedures on the interossseous and palmar cutaneous nerves. The radial nerve is used to code the dorsal digital, musculospinal, and posterior interossseous nerves. We note that the thoracic autonomic nerves are used to code plexuses that one would expect in the area of the chest, the cardiac, esophageal, and thoracic and pulmonary plexus. The greater and lesser and least splanchnic, from the Greek meaning an organ, nerves are sympathetic nerves to the organs in the thorax. The abdominal sympathetic nerve has many nerves that are coded to it. The celiac plexus, also called the solar plexus, the hepatic, gastric, renal, splenic, suprarenal, pancreatic plexuses supply the expected areas, while the mesenteric plexuses and ganglia supply the mesentery, and the hypogastric plexuses serves the pelvic cavity. The myototic plexus, also called Auerbach's plexus, is a primary nervous supply to the digestive system. The pelvic splenic nerve regulates the evacuation of the bowels. The Meninges plexus, the submucous plexus, function to innervate smooth muscle, while the abdominal aortic plexus surrounds the abdominal aorta. And your word parts: cervical is neck, and the thoracic is chest. The lumbar nerve is used to code the superior clinic and the lumbosacral trunk, whereas the pudendal nerve is used to code the posterior labial or posterior scrotal nerves. The sacrosympathetic nerve is used to code the ganglion impar, also called the ganglion of Walther, the pelvic and sacropelvic nerve, and the sacral ganglion. The saphenous nerve is coded to the femoral nerve. The tibial nerve is used to code the medial popliteal, the medial cerebellum, and the medial and lateral plantar nerves. The peroneal nerve is used to code the lateral cerebellum nerve. And your word parts: lumbo is lower back, femoro is femur, and peroneo is tibia. Review question. The outer covering of the meninges is the A. Arachnoid membrane, B. Dura mater, P. Pia mater, or D. Plexus. And the answer is B. Dura mater. Signs and symptoms codes R13 through R56. Aphasia is a lack or impairment of the ability to form or understand speech. Less severe forms include dysphagia or dysarthria. Dysarthria refers to difficulty in articulation, which is pronunciation of speech. Asthenia is weakness, literally a condition of no strength. Ataxia is lack of coordination. Dysphagia is difficulty in swallowing. And paresthesia is a feeling of prickling, burning, or numbness. Your word parts: A is no, not without. Phase O is speech. Ia is condition. Sthenia is condition of strength. Taxo is order or coordination. Dys is difficult or bad. Phagio is eat. Para is abnormal. Anesthesio is feeling. Some more signs and symptoms. Codes R13 through R56. Amnesia is the loss of memory caused by brain or severe emotional trauma. Athetosis is continuous involuntary, slow, withing movement of the extremities. A coma is a deep, prolonged unconsciousness from which the patient cannot be aroused. It is usually the result of a head injury, neurologic disease, acute hydrocephalus, intoxication, or metabolic abnormalities. A convulsion is a neuromuscular reaction to abnormal electrical activity within the brain. Causes could include fever or epilepsy. A recurring seizure disorder, also called a seizure. Fasciculation is involuntary contraction of small local muscles. A spasm is an involuntary muscle contracted on sudden onset. Some examples could be the hiccups, tics, and stuttering. Syncope is fainting. A vasovagal attack is a form of syncope that results from abrupt emotional stress involving the vagus nerve effect on blood vessels. Tremors are rhythmic, quivering, purposeless skeletal muscle movements seen in some elderly individuals and in patients with various neurodegenerative disorders. Vertigo is dizziness, abnormal sensation of movement when there is none, either of oneself moving or of objects moving around oneself. Traumatic conditions, code SO6. Concussion is a serious head injury characterized by one or more of the following: loss of consciousness, amnesia, seizures, or a change in mental status. A cerebral contusion is a head injury of sufficient force to bruise the brain. Bruising of the brain often involves the brain's surface and causes an extravasation of blood without rupture of the pyrarachnoid. It is often associated with a concussion. A hematoma is a localized collection of blood, usually clotted in an organ, tissue, or space, due to a break in the wall of blood vessels. Epidural hematomas occur above the dura mater. Subdural hematomas occur between the dura mater and the acronoid meninges. This may be the result of a traumatic brain injury, also known as a TBI. And your word parts: hemato is blood, and oma is tumor or mass. But be careful. Although the word origin of the term hematoma means a blood tumor, this is a misnomer. A hematoma is a mass of blood that has leaked out of the vessel and pooled. Review question. Which of the following is an abnormal feelings of burning, prickling, or numbness? A. Athetosis. B. Fasciculation. C. Paresthesia. Or D. Syncope. And the answer is C. Paresthesia. Inflammatory diseases of the central nervous system, codes G00 through G09. Encephalitis is inflammation of the brain, most frequently caused by a virus transmitted by the bite of an infected mosquito. Meningitis is an infection of the inflammation of the membranes covering the brain and spinal cord, most commonly due to a viral infection, although more severe strains are bacterial or fungal in nature. And your word parts: encephalo is brain, itis is inflammation, and meninges is meninges. Systematic atrophies primarily affecting the central nervous system, codes G10 through G14. Amyotrophic lateral sclerosis, ALS, is a degenerative fatal disease of the motor neuron in which patients exhibit progressive muscle weakness and atrophy, also called Lou Gehrig's disease. Huntington's disease is an inherited disorder that manifests itself in adulthood as a progressive loss of central control, uncontrollable jerky movements, and dementia, also called Huntington's chorea. Chorea is derived from the Latin word for dance. Post-polio syndrome, PPS, although poliomyelitis, an inflammation of gray matter of the spinal cord, has been virtually eradicated. Some patients who had polio report symptoms of exhaustion and muscle and joint pain decades after their initial illness. And their word parts is A is no, not, or without. Myo is muscle. Tropo is development. Ik pertaining to. Latero is side. All pertaining to. Sclerosis, conditioning of hardening. Post equals after. Polio is equal gray. Sin is together. And drome equals run. Extrapyramidal and movement disorders, G20 through G26. Parkinson's disease, or PD, is a progressive neurodegenerative disease characterized by tremors, vascularizations, slow shuffling gait, bradykinesia, which is slow movement, dysphagia. Its cause is unknown. The word parts: brady is slow, kinesia equals movement, dis is bad or difficult, phaso equals speech, ia is condition, phago to eat or swallow, and ia is condition. Degenerative disorders of the central nervous system, codes G30 through G32. Alzheimer's disease, AD, is a progressive neurodegenerative disease in which patients exhibit an impairment of cognitive function. The cause of the disease is unknown. Alzheimer's is currently the most common cause of dementia. Mild cognitive impairment, MCI, is a loss of impairment of cognitive abilities, although not as severe as AD. It's also called incipient dementia. Demyelinating diseases of the central nervous system, codes G35 through G37. Multiple sclerosis, or MS, is a neurodegenerative disease characterized by the destruction of the myelin sheaths on the CNS neurons, also known as demyelination, and their abnormal replacement by the gradual accumulation of hardened plaques. The disease may be progressive or characterized by remissions and relapses. This cause is also unknown. Episodic and paroxysmal disorders. Dysomnias are disorders of the sleep-wake cycles. Insomnia is the inability to sleep or stay asleep. Hypersomnia is an excessive depth or length of sleep which may be accompanied by daytime sleepiness. Epilepsy is a group of disorders characterized by some or all of the following: recurrent seizures, sensory disturbances, abnormal behavior, and or loss of consciousness. The types of seizures include tonic-clonic, which is grand mal, accompanied by temporary loss of consciousness and severe muscle spasms. And absent seizures is petit mal, accompanied by loss of consciousness exhibited by unresponsiveness for short periods without muscle movement. Status epilepticus is a condition of intense, unrelenting, life-threatening seizures. Pseudoseizures are false seizures. It causes maybe trauma, tumor, intoxication, chemical imbalance, or vascular disturbances. A migraine is a headache of vascular origin. The onset of a migraine may be preceded by an aura, which is a sensation of light or warmth. Migraines are further classified as intractable, difficult to treat, and with or without status migrainous, which is lasting longer than 72 hours. Narcolepsy is a disorder characterized by sudden attacks of sleep. Cataplexy is the loss of muscle tone that results in collapse without loss of consciousness. A transient ischemic attack, a TIA, is a temporary ischemia of a cerebral tissue due to an occlusion blockage from a thrombus or an embolus, or as a result of cerebral hemorrhage. Results of TIAs depend on the duration and the location of the ischemia. The sequelae may include paralysis, weakness, speech defects, and sensory changes that last less than 24 hours. And your word parts: dis is difficult, somno is sleep, ia is condition, in is not, hyper is excessive, epi equals above, lepsy equals seizure, pseudo is false, narco is sleep, and kata is down. Nerve root, and plexus disorders, codes G50 through G59. Bell's palsy is a paralysis of the facial nerve. The unknown is the cause, and the condition usually resolves on its own within 6 months. Carpal tunnel syndrome, CTS, is a compression injury that manifests itself as fluctuating pain, numbness, and paresthesias of the hand caused by compression of the median nerve at the wrist. Calsalgia is nerve pain, described by patients as a burning pain. Neuralgia paresthesia is a condition of burning, tingling sensation in the thigh caused by injury to one of the femoral nerves. And your word parts: carpo equals wrist bone, all is pertaining to, sin equals together, drone is to run, caso is burning, algia equals pain, mero is thigh, par equals abnormal, and aesthetica is feeling or sensation. Trigeminal neuralgia is a chronic facial pain that affects the fourth cranial nerve. usually experienced on one side of the face. The pain is episodic and intense. It's also known as tic douloureux. And your word parts, neuro is nerve, and algia equals pain. Polyneuropathies and other disorders of the PNS, codes G60 through G64. The Guillain-Barré syndrome is an autoimmune disorder of acute polyneuritis, producing profound myasthenia that may lead to paralysis. Polyneuropathy is a general term describing a disorder of several peripheral nerves. And your word parts, poly equals many, neuro equals nerve, and pathy equals disease or condition. Myoneural junction and muscles, codes G70 through G73. Muscular dystrophy is a group of disorders characterized as an inherited progressive atrophy of skeletal muscle without neural involvement. Myasthenia gravis is usually a severe condition characterized by fatigue and progressive muscle weakness, especially of the face and throat. The word parts, musculo is muscle, are pertaining to, dis is bad or abnormal, tropho is development, y is process of, myo, muscle, a, without or no, sthenia, condition of strength, and gravis, severe. Review question. What is the term that means a seizure of sleep? A, Bell's palsy, B, narcolepsy, C, sciatica, or D, coprolalia? And your answer is B, narcolepsy. Terms related to cerebral palsy, other paralytic syndromes, and other disorders of the nervous system, codes G80 through G91. Paralytic conditions are generally described by the suffixes plesia, meaning paralysis, which means the loss of muscle function, sensation, or both, and paresis, meaning a slight paralysis. These conditions are usually further described by the area of the body affected. Diplegia means di is two, is a paralysis of the same body part on both sides of the body. Hemiplegia, hemi, which means half, is paralysis on the left or right side of the body. Hydrocephalus is an abnormal accumulation of fluid in the ventricles of the brain. This is usually diagnosed in babies, but may also occur in adults as a result of a stroke, trauma, or infection. Locked-in state is damage to the upper brainstem that leaves the patient paralyzed and mute. Monoplegia, mono equals one, is a paralysis of one limb on the left or right side of the body. Paraplegia, which para means abnormal, is paralysis of the lower limbs and trunk. Quadriplegia, quadri, which means four, is paralysis of arms, legs, and trunk. So over as you're on your word parts, we kind of just talked about on some of these. We got cerebro is cerebrum, all pertaining to, di equals two, plegia is paralysis, hemi is half, paresis, slight paralysis, hydro equals water, cephalus is head, mono equals one, para is abnormal, and quadri equals four. A special note, paralysis is the loss of muscle function. Flaccid paralysis is characterized by weakening or loss of muscle tone, is associated with lower motor neuron damage. Some examples are polio and ALS. Spastic paralysis is characterized by involuntary muscle contractions and lack of tendon reflexes, and is the result of upper motor neuron damage. Multiple sclerosis is an example of this. But you want to be careful. If the suffix paresis is used, it indicates a weakness of the body part affected, not a total loss of muscle tone. The CM Guideline Alert. 6A, dominant and non-dominant side. Codes from category G81 hemiplegia and hemiparesis, and subcategories G83.1, monoplegia of lower limb, G83.2, monoplegia of upper limb, and G83.3, monoplegia unspecified. Identify whether the dominant or non-dominant side is affected. Should the affected side be documented but not specified as dominant or non-dominant, and the classification system does not indicate a default, code selection as follows. For ambidextrous patients, the default should be dominant. If the left side is affected, the default is non-dominant. If the right side is affected, the default is dominant. But these guidelines can be confusing. But if you need to focus on the terminology of dominant versus non-dominant for paralysis that occurs on one side of the body. Review question. Paralysis of the arms, legs, and trunk is A, hemiparesis, B, paraplegia, C, paraparesis, or D, quadriplegia? And your answer would be D, quadriplegia. Neoplasms of the CNS. Astrocytoma is a tumor arising from a star-shaped glial cell that is malignant in higher grades. A grade 4 astrocytoma is referred to as a glioblastoma multiforme, the most common primary brain cancer. Epidymoma is a tumor of the cells that lines the ventricles of the brain. In children, epididymomas are usually intracranial, and in adults, they are most often intraspinal. Medulloblastoma is a tumor that arises from the embryonic tissue in the cerebellum, most commonly seen in children. A meningioma is a slow-growing, usually benign tumor of the meninges. Although benign, it may cause problems because of its size and location. A neuroblastoma is a highly malignant tumor arising from either the autonomic nervous system or the adrenal medulla. It usually affects children younger than 10 years of age. Your word parts: astro equals star, cyto is cell, oma is tumor, medullo is medulla, blasto is embryonic, and neuro is nerve. Neoplasms of the PNS. A granuloma is usually a benign, slow-growing tumor that originates in the autonomic nervous system cells. Neurofibromas are benign fibrous tumors of tissue surrounding the nerve sheath. A schwannoma is a tumor of type that's benign or malignant that is most commonly found in the inner ear. A vestibular schwannoma. And your word parts: ganglio is ganglia, neuro is nerve, oma is mass or tumor, and fibro is fiber. Review question. Which of the following is a benign tumor? A glioblastoma multiforme, B, a medulloblastoma, a C, a meningioma, or a D, a neuro? And your answer is C, meningioma. Procedures. A cerebral angiography is an X-ray of the cerebral arteries, including the internal carotids, taken after the injection of contrast medium. The procedure is also termed a cerebral arteriography. An echoencephalography is an ultrasound examination of the brain, usually done only on newborns because sound waves do not readily penetrate the bone. Amyelography is an X-ray of the spinal canal after the introduction of a radiopaque substance. And your word parts: cerebro is cerebrum, all is pertaining to, angio is vessel, graphy is recording, echo is sound, encephalo is brain, and myelio is spinal cord. An electroencephalography is also the recording of the electrical activity of the brain. It may be caused in the diagnosis of epilepsy, infection, and coma. An evoked potential is the electrical response from the brainstem or the cerebral cortex that is produced in response to specific stimuli. The results in a distinctive pattern on the EEG. A polysomnography is a measurement and record of the number of functions while the patient is asleep. Some examples could be cardiac, muscular, brain, ocular, or respiratory functions. And it is most often used to diagnose sleep apnea. Your word parts: electro is electricity, encephalo is brain, graphy is recording, poly equals many, and somno is sleep. Review question: what is a recording of the spinal canal? A, echoencephalography, B, an EEG, a C, a myelography, or D, PSG? And your answer is C, myelography. Babinski's reflex in the dorsiflexion of the great toe when the plantar surface of the sole is stimulated is a normal expected result. If it is absent, neurological pathology is present. Babinski's sign is the loss or diminution of the Achilles tendon reflex that is seen in sciatica. Deep tendon reflexes are an assessment of an automatic motor response by striking a tendon. This diagnostic procedure is useful in the diagnosis of TIAs and CVAs. Babinski's sign is the loss or lessening of the Achilles tendon reflex seen in sciatica. Neuroendoscopy is the use of a fiber optic camera to visualize neural structures. It is used for placing a shunt in the hydrocephalic patients. A nerve conduction test is used to test the function of the CNS and the PNS. Conduction time through a nerve is measured after a stimulus is applied. It is used to diagnose polyneuropathies. A lumbar puncture is a procedure to aspirate cerebrospinal fluid, CSF, from the lumbar sacranoid space. A needle is inserted between two lumbar vertebrae to withdraw the fluid for diagnostic purposes. This is also called a spinal tap. And your word parts: lumbo is lower back, and R is pertaining to. The review question: which of the following is a measure of many functions during sleep that is used to diagnose sleep apnea? A, EEG, B, DTR, C, LP, or D, PSG? And your answer is PSG. A craniotomy is an incision into the skull as a surgical approach or to relieve intracranial pressure. It is also called trepanation. Your word parts: cranio is cranium and skull. Tomy is cutting. Vagotomy is a cutting of the branch of the vagus nerve to reduce the secretion of gastric acid that causes stomach ulcers. Note that the term truncal refers to the trunk or main part of the nerve. And then over on your left are your word parts. Vago is vagus nerve and tomy equals cutting. A neurectomy is an excision of part or all of a nerve. Neuroplasty is a surgical repair of a nerve. A neurotomy is the incision of the nerve. And look over at your word parts. Neuro is nerve. Ectomy is cutting out. Exeresis is tearing out. Plasty is surgical forming. And tomy is cutting. A cordotomy is an incision of the spinal cord to relieve pain. It can also be spelled as cordotomy. A ganglionectomy of the dorsal root is a removal of the dorsal root in order to treat pain. A nerve block is the use of anesthesia to prevent sensory nerve impulses from reaching the CNS. A rhizotomy is the resection of the dorsal nerve root of the spinal nerve to relieve pain. A sympathectomy is a surgical interruption of part of the sympathetic pathways for the relief of chronic pain or to promote vasodilation. A tracheotomy is the cutting of the nerve tract in order to relieve pain. Transcutaneous electrical nerve stimulation is a method of pain control effected by the application of electrical impulses to the skin. This is also notes the TENS is the acronym. And your word parts: cordo is spinal cord, tomy is cutting, ganglio is ganglion, ectomy is cutting out, rhizo equals spinal nerve root, sympatho to feel with, tracto is trace or pathway, trans is through, cutaneo is skin, and os is pertaining to. Chemothalamiectomy is an injection of a chemical substance to destroy part of the thalamus. It's used to treat Parkinson's and Huntington's disease. A pallidotomy is a destruction of the globulus pallidum to treat Parkinson's disease. The procedure relieves muscular rigidity and tremors. Neurexeresis is the removal of the fifth cranial nerve to treat trigeminal neuralgia. A hemispherectomy is the removal of cerebral hemisphere to treat intractable epilepsy. A pneumothorax is the crushing of the phrenic nerve to cause its paralysis, also called a phrenicotripsy and a phrenicolasis. And your word parts? Chemo is chemical or drug, thalmo is thalamus, ectomy is cutting out, paleto is globulus pallidum, tomy is cutting, neuro is nerve, exeresis is tearing out, phreno is diagram, and emphyrexis is obstruction or crushing. A ventricular sternotomy is the creation of the new opening between a blocked ventricle and a cerebral cistern. It is used to treat hydrocephalus. A ventricular peritoneostomy is a procedure to drain fluid from the ventricles of the brain through a shunt, catheter, or valve that leads to the abdominal cavity. An endoscopic ventriculostomy is a new opening between the third ventricle and the subarachnoid space used to treat one type of hydrocephalus. And your word parts? Ventriculo is ventricle. Cisternal is box or cistern. Stomy is making a new opening. Peritoneal is the peritoneum. Endo is within. Scopic is pertaining to viewing. Be careful. A tracheostomy is a new opening between the ventricle of the brain and the upper chamber of the heart. Sometimes the common word parts can cause confusion. Pharmacology. Analgesics reduce pain. Narcotic analgesics have a CNS effect. NSAIDs are non-steroidal anti-inflammatory drugs are opioids or COX-2 inhibitors. Anesthetics cause a loss of feeling or sensation. They can act either locally, which is a local anesthetic, or systemically, which is a general anesthetic. And a general anesthetic can induce unconsciousness. Anticonvulsants reduce the frequency and severity of epileptic or other convulsive seizures. Antiparkinsonian drugs are effective against Parkinson's disease. Antipyretics reduce fever. Hypnotics promote sleep. They may also be referred to as soporifics or somnifications. Many hypnotics have a sedative effect also. Neuromuscular blockers are drugs that block the action of acetylcholine at the motor nerve and plate to cause paralysis. Many be used in surgery to minimize patient movement. Sedatives inhibit neuronal activity to calm and relax. Many sedatives also have hypnotic effects. Stimulants increase synaptic activity of targeted neurons in the CNS to treat narcolepsy, attention deficit disorders with hyperactivity, fatigue, and to suppress the appetite. Review question. A new opening between a blocked ventricle of the brain and a cerebral cistern is A. Ventriculostomy, B. Ventriculocysternotomy, C. A ventriculoperitoneostomy, and D. TENS. And your answer is B. Ventriculocysternostomy. Suffixes and root operations for the nervous system. An ectomy is excision, resection, or destruction. Emphraxis is destruction. Exeresis is extraction. Plasty is repair or supplement. Stomy is bypass or drainage. And tomy is drainage, division, and destruction. Sort these terms into the correct categories. Categories are anatomy, physiology, pathology, and procedures. Your terms: 1. Neuroexeresis, 2. An EEG, 3. Hydrocephalus, 4. Synapse, and 5. Neuralgia. Your A and P would be 4. Synapse, and 5. Neuralgia. Your pathology: hydrocephalus, 3. And your procedures would be neuroexeresis and EEG. And this concludes the lecture for Chapter 11, the nervous system.